Good afternoon and good morning for those who are joining us from the United States. Thank you for joining today's edition of AJC Europe Connects. In this very difficult and uncertain period, when some of us are still locked down at home and others not anymore, many questions arise as to what our world will look like after the crisis. For that reason, AJC Europe has decided to continue to connect, to provide opportunities to come together and think, exchange, and advocate for values and issues we care about. Today's discussion about exiting lockdown is extremely timely as many countries prepare themselves to enter into this new phase. This is our immense privilege to be joined today by our panelists, which are among the best experts on today's situation. They come from Austria, Denmark, and Israel, three countries which have seemed to battle more successfully the virus than others, and which already started to ease restrictions a few weeks ago. On the panel today, Balicer from Israel, the director of the Clalit Research Institute, chief innovation officer and director of innovation division at the Clalit Health Services, a professor of the health department at the Faculty of Health Sciences at the Ben Gurion University of the Negev in Israel. Gary Foitik from Austria, the federal commander in charge and member of the managing board of the Red Cross in Austria, and Bo Lidegaard from Denmark, a writer, historian, and advisor. They will be in conversation with Julie Dacroix, Associate Director of AJC Europe. I kindly remind our audience that after having heard from our panelists, we will take your questions. Questions can be sent via email at paris@ajc.org or by using the Q&A chat featuring Zoom. Julie, the floor is yours.
Thank you, Barnabas, and thank you to our panelists for joining us today. Without further ado, I would like to start out with you, Bo. Since Denmark has been the first European country to start opening schools as soon as mid-April. After that, there was a slight increase of the number of infected people and followed by a decrease. What's the situation like today in Denmark, and is the fear of a second epidemic wave totally gone?
Well, over the last week, we have seen another wave of political decisions in which the government have been able to pull together the entire parliament, all political parties, for a more rapid schedule for further reopenings in what we call phase 3 and 4. Some rolled out now, some in a couple of weeks. And in this time span, we are opening the entire elementary school. We are reopening part of boarding schools. We are reopening shopping centers and restaurants. And in a later phase, we are also scheduling to reopen cultural institutions and basically most institutions of society with certain restrictions. And at the same time, we have eased the social distancing requirements from 2 meters to 1. So far, the reopening that has now been underway with graduate measures for 3 or 4 weeks have not caused a permanent rise in the reinfection rate, nor in the total number of infected. So we have a steady decrease in reinfections and a declining reinfection rate from 0.9 and going slightly downwards almost by the day. And this has caused our health authorities over the last 24 hours for the first time to say that they expect that a second wave is very unlikely, but obviously not excluded.
Thank you. And how Denmark has done differently from other countries in its way of handling the epidemic, because it is often depicted, as well as Austria, as a kind of laboratory country in Europe in that regard. So how do you explain this relative success and this very optimistic prospect that you are sharing? And basically, what are the lessons that can be taught from the Danish experience and that can be helpful for others in handling the exit from lockdown?
I'll just quote two factors. Obviously, it's a very mixed picture, but I'll quote two. And one of them, unfortunately, is not an advice we can transfer, because that is to act very early. I think part of the reason for the relative success here was that we were among the first European countries to act. And when we acted decisively, which was on the 11th of March, it was with an all-out lockdown and closure of the borders. So we took very stringent measures upfront, not in terms of forcing people to stay in their apartments, as some other European countries have done. There's never been restrictions on where you could move, how much you could be outside, or where you could go. But basically, most of society, especially in the public sector, turned down, and every restaurant and public space was closed on the 11th of March at no notice. So this very early and very decisive step successfully broke the contamination strings. And from then, there was this 2 or 3 weeks that we have seen in all countries. And from there, we have had a very steep decline in the number of infections. So that's one point, early action. The other part, which is slightly more abstract, is that our society proved in this situation, where the magnitude of the measures came completely as a surprise to most citizens, and the whole situation, of course, here as in any country, very much took our society aback and demanded a very rapid reckoning of a very different situation. That it turned out that the cohesion of society was very strong. All major steps have been approved by unanimity in Parliament. The government has had a very strong support, not from a very high level, I must say, at the outset, but the Prime Minister has been able to assert herself as a strong leader in this situation, and people have accepted the necessity of the measures, which in turn has implied that the authorities have not used force or cohesion to force through the measures. Basically, it has been the government saying, this is what we need to do, and the public at large has accepted that this was necessary, and the 3 basic rules, which you see all over, with wash your hands, keep physical distance, and do not gather more than 10 people together. Those very simple rules have turned out to be very efficient when they are applied at almost 100% of the population. So the public has sort of taken in these measures and have turned out to be more, I wouldn't even say disciplined, because I don't actually think it's about discipline. I think it's about accepting that this is necessary for us to come out of this situation. And there's been a very strong adherence and support for collective move, and a lot of solidarity also in trying to address all the inconveniences that, of course, follow a lockdown, as we have seen in any country. So I would point to early action and strong social cohesion as the main factors.
Thank you so much. I would like to turn now to Geri, because Austria also in mid-April took some measures to organize the reopening, the progressive reopening of businesses with some restrictions. So what's the situation today? Have all the restrictions been lifted as we speak? How things have developed a month after the first moves to lift the restrictions? And also, can you maybe react to what Bo was saying about social cohesion? And I have a more specific question about the role of civil society in preventing a potential second wave in Austria. How does this take effect?
So, first of all, let me say thank you for inviting me here and the opportunity to speak. Thank you for the wonderful opportunity, and good afternoon to all of you. So the situation in Austria is now, in terms of easing the restrictions, is that not everything is already possible to do. So, for example, the restaurants will open this Friday. So still 3 more days to go. Schools will open next Monday, but in the second step. The first step was all those who are in their final years. They are in school already since beginning of May. Next Monday will be the majority of all the students from grade 1 till grade 8. So these are 700,000 students. And then 2nd or 3rd of June, there will be the next opening step, and the last one, the rest. So the senior students aged 15 plus will appear to school again. These are approximately 300,000. But however, schools don't look like schools looked like in March, beginning of March, because still it's just the classes are divided into groups A and B, and they have a shift system now in schools. So for 5 days, Group A will be physically present in schools, and Group B will be at home teaching and doing all the home exercises, and then every Thursday the shifts are changing. Plus, of course, gatherings, events, also cultural facilities are still closed. Even then, there will be an ease about this maybe beginning of June. But for example, the Austrian Football League or other big events, they will not happen with audience, but just without. And what Austria is famous for, all the cultural events, the summer festivals and so, they are still with a big question mark on their agenda, on their schedule, because still it's not clear whether they will happen or how they will happen. Because the risk assessment is that indoor events are of a higher risk than outdoor events. So in summer, it will be easily possible to have outdoor events, at least with a seated audience, because there you can have the spatial distance between each person. In indoor events, this will be much harder because even if from a medical point of view or from an epidemiological point of view, it will be possible, it won't be feasible for many of the providers, maybe because with a capacity of 20% or 25% of your usual capacity, you cannot run a cultural event economically. So that there's still some big issues. But however, what I'd like to add is, because we heard already from Bo what Denmark success was, and I like to agree on this. The same thing was true for Austria. We had one more aspect. I think this is worth to mention. We had the strategy from the very beginning, so from February on, to avoid contamination of healthcare facilities. So what we did is, for example, we did all the testing and the care for those who are just affected in a minor degree health-wise. We said, okay, stay at home. We will care for you at home. We will do the test for you at home. Don't go to healthcare facilities. Don't go to the clinic patients. Don't go to the hospitals. Just stay where you are. Isolate yourself. We will be coming to help you there. And that made it possible that in healthcare facilities and also in elderly homes, for example, we had a very low, or still have a very low rate of transmission and infection. And because these are the most vulnerable people, you know, people that are already affected with some serious health conditions, and people that are of a higher living age. So that was a very successful in our view, a very successful term. You were asking about the social cohesions and about the role of civil society organizations. In Austria, we have a very strong civil society in terms of we are used to care for each other. We are used to volunteer. We are used to do this in an organized way. So, for example, in 2007, we already created Team Austria. That is a way to register online and to do some, you know, very basic and spontaneous way of volunteering and helping. Also, you could do some online volunteering with Team Österreich. And this was providing, again, very useful in Austria, because all the neighborly aid, all the social cohesion, all you know, psychosocial counseling, for example, or all the communication aspects. So we staffed hundreds of people with, you know, telephone counseling lines, with information facilities, with all this, and this proved very helpful. On the one hand side, it was a very positive, you know, also social experiment we were running in March and beginning of April, and the solidarity was big. You know, all the awareness, the effectiveness, the compliance was very high. On the other hand, right now, what we're seeing is that some groups of societies are starting a discussion why I am not allowed now to do my business, why the others are allowed to do. So there's this, you know, complex situation about, you know, that others are allowed to do something, I'm not, others are allowed to earn money again, I'm not, I'm still have barriers to overcome to live my normal life again. And this is sort of, you know, disaggregating the society. So the solidarity and the compliance, the beginning was, the more it's decreasing now, at least when you watch media, when you read media, and you see that there is more room now for people who are really angry with the establishment, with the politics, and who are really complaining about all the conditions they need to live on. On the other hand, civil society, of course, still plays a big role and will continue to do so.
Thank you. Turning it to you, Ran, you work closely with the World Health Organization and the Israeli government with an advisory role. The Deputy Minister of Health declared on Sunday, that this week, as we speak, would be crucial in Israel because it would enable the government to know if they can continue the reduction of restrictions. Can you explain us why and give us your opinion? Are you optimistic at that stage?
So yes, and I would like to join the comments of my two predecessor speakers on what is the key issue here in this event, and it is act early and act decisively. Israel, I think, was closing its borders or its incoming flights from China on January. Actually, on January 30, already the first flights were blocked. And whenever the first signs of a problem in every country has begun, Israel was one of the first to act in order to either close the borders or to order isolation and quarantine of those that were returning. And that was exceedingly helpful in controlling the event. We also, I think, also as a country, took pretty early steps and very gradual as the morbidity expanded in order to try to delay full lockdown as much as we can with other means and measures as much as the safety buffer could allow us. And so this has gradually came into full lockdown fairly late. And about 2.5 weeks ago, we have lifted this full lockdown and began very rapid opening of society, starting with commerce, with open commerce outside of the malls, and then allowing also indoor commerce to take place. Most of the workplaces went into almost business as usual by now. And in terms of schools and kindergarten, we have decided to wait a little longer with that, because I know there's a lot of debate in the literature whether kids are both infected and infective, and whether they are spreaders as much as they are in flu and in other respiratory diseases or not. The common wisdom right now is that children can be infected, that they are infectious to others, but potentially not as they are in diseases like the flu. They're not the key disseminators of disease. But as we have decided to open up, we have made a little more careful and gradual decisions there. Grades A to C are now open in a form of capsules. So every class is divided into groups of 5 kids that are separated from each other with their own teacher and their own class where they actually go to school. And this was an exceeding careful measure, because again, we wanted to see, the problem with this event really is the delayed reading that we have about the measures that we have taken. And so in terms of decision making, this is really a nightmare for any decision maker. It is like the picture that you get about the state of affairs right now comes in a 2-week delay. And so you make a decision now, and within 2 weeks, you'll know whether you have completely went off the chart or you made very conservative or very exact decisions. So it is all a matter of what is the buffer that you have been able to create in order to make mistakes. So when we had to begin this process, let's take, for instance, March. On March 12, we had 30 patients per day, newly infected incidence rate. 12 days later, we had 500. And so these are 4 doubling times within 12 days. Now, that is not something decision makers are happy with in an event that goes exponential. And that made us take some very decisive and steps, including lockdown, and to wait a little bit before we go back to normal in order to make sure that we do not return there, because otherwise we'd lose the buffer and we'd reach a situation of saturation of our health system and everything that goes with that, from increased mortality to basically all of the detrimental effects, societal effects. But around 2.5 weeks ago, we started seeing a very steep decline in new cases. And even at the beginning of this steep decline, we knew we were safe enough. If within 2 weeks or several weeks of lockdown, we already see a decline, we knew that the kind of the trajectory would stay. And so we can take some pretty extreme measures at that point in the other direction and in opening up. And so we've taken more, I think, aggressive measures of opening up the economy, and in many instances that otherwise we wouldn't have dared to do. And this has proved to be correct, because by now we have about 24 cases a day, something like that. And it seems like we're still under control despite everything that we've done. And to your beginning question, what is so special about this week is that, again, it is a couple of weeks since the major opening of so many aspects of society. And it is a question that we now need to see whether this new equilibrium, this new normal, this new state of affairs, that people have social distancing and masks, and the recommendation to keep at home when they're sick, and all of the other things that we'll probably talk about today that have to do with contact with patients, testing and contact tracing and isolation and quarantine, and I would say local differential lockdowns. Now, all of these together should give us the comfort on making society go back to as close to normal as we can. And this is the week that we'll figure out whether we got it right, or maybe we need to be a little more careful in what we do, because we've seen in other countries, you make the wrong move, you have a sudden incline, and then you need to reassess where you are.
Thank you. Now, I would like to move to another topic with you both, since you're a former diplomat. I would like to ask you about European cooperation on this specific issue of exiting lockdown. We've witnessed, of course, that in Europe there are a lot of different voices, but at the same time, the EU has been active, especially towards economic recovery. How do you see the near future of European cooperation? And do you think that the EU has the capabilities and the necessary tools to lead in unity in this exit strategy? Can you please unmute?
Yes, these are big questions, Julie, because we are struggling, as you know, in Europe to find the answers, and we don't know them yet, but let me make a few comments. One is that as the crisis started, Europe was mostly paralyzed for a number of reasons. Like most governments, it was very ill prepared for a pandemic of this order of magnitude, and with this very rapid development, but still delayed, that Rand was just alluding to, which of course made it very hard for decision makers to act real time, because their actions were sort of always based on information that was delayed a couple of weeks. So both member states and the European Union were taken aback. Europe, as you know, has none or very little common authority competence in the area of health and healthcare, which is basically taken care of at the national level. So as long as this was a healthcare issue, there was little Europe could do, and indeed little it did. This has changed, and Europe is engaging a lot on the economic side, both through the Euro Bank, the central bank, but also increasingly in terms of the aid packages that Europe is now trying to get together. And as you know, 2 weeks ago, for the first time, after a lot of tension, there was agreement on the parameters of a major recovery package in an order of magnitude unprecedented in Europe. So we are, as we speak here today, we as the European Union is struggling to get both our next 7 years budget presented and intertwined with the 7-year budget outline, which the Commission will now present either next week or the following week. Intertwined with this budget, there will be a front-loading recovery package that through a range of different means will help member states and private enterprises overcome the crisis and get into the other side in the recovery. With the stakes as high as they are here, and with the economic disaster as widespread as it is, we are struggling in Europe to try to get a package approved at a sufficiently high level of ambition. And whether we will eventually succeed before summer to both agree our next 7-year budget and this major recovery package is still an open question. If you ask me, my personal evaluation and assessment, we will get there. I think the political will across Europe is sufficiently strong for us to overcome the difficulties. But there is one particular bug that will add also an unprecedented level of complexity, which is when you are discussing both a budget in this order of magnitude and at the top of that, a major recovery package, you really need leaders to be able to meet physically, to sit in the same room and negotiate. Right now, that is not possible. And a lot depends on when leaders feel prepared, not only to go and meet in Brussels, but also to come back to their respective countries and being able not to go into self-isolation or confinement for 2 weeks, which very few political leaders can afford to do in times of crisis like this. So in addition to all the political and economic difficulties, there's also a practical difficulty in actually getting the things agreed and approved. But to sum up, Europe is stepping up. Europe has a common idea on how to address the economic and social and entrepreneurial side of this. It will require a lot of political will. It will probably also require some countries to leave long-established red lines and move into uncharted territory in order to create new instruments that are able to provide the assistance necessary. And finally, it will need that we are able to meet physically, and optimists think we will be at the beginning of June or a little into June. But again, it's very hard now to make decisions on these things because, as it was pointed out, we keep to being 2 weeks delayed, and it's very hard for us to look into the future because, as we have also seen and as we're seeing now in China, even in areas where the disease has been all but eradicated, it now seems to pop up again and require additional measures in order to avoid a second outbreak.
Thank you. Ran, we just discussed intra-European cooperation. I would like to move on to the issue of EU-Israel cooperation in medical and sectors. We can't hear you very well. I'm not sure it's mine. Israel has been one of the countries which actually cooperated the most at the global scale since the outbreak of the pandemic. How has cooperation specifically with Europe been at play, and what was Israel's contribution in that cooperation? Jerusalem Post this morning was reporting about a simulator that Israeli researchers put together for simulating exit strategies. Would it be something, for instance, that could contribute to this cooperation?
So yes, and I would like to give one example that I think that would be most useful, I think, for many countries that are considering the exit strategies now on very practical. Israel in general, I think, is very much involved in the issue of big data analytics and AI in general, and especially in healthcare, and has very interesting repositories that go years back of health data that is useful in order to provide medical and health inferences that can be used. And we were actually able to use these things in real time in order to provide guidance and inferences into managing this event. So for example, very early in the beginning of this crisis, we have used a previous AI-driven model in order to identify the patients most at risk in our entire membership, in the entire country, in order to identify those with the highest risk if they get infected to have a severe illness. We did this by adjusting previous flu models to the data that came in from the beginning China and then from Italy. And by doing this process, we have been able to do a very early guesstimate of which one of our patients would be at risk. And then we have approached them proactively and told them, stay at home. Do not leave the house. If you need any medical services, we will provide them to you. Either physically people will come or through online care. And we have developed a lot of online care solutions for them. So we make sure that they will stay home. I think this is part of the reasons of that we see such low mortality in Israel as compared to, you know, only 1.5% of our patients have been, have actually had the mortality rate was, and it's fairly low as compared to many other countries. So that was helpful in that. What we are doing now in order to simplify this, because this model is very complex and based on many dozens of parameters and very difficult to replicate in other systems, we created a simplified version of this model that is based on points. And there was a Wall Street Journal article about this that I will later on forward so we can disseminate to anybody who's interested, that explains how it's done. But very generally speaking, every patient on their own, without the need for a health professional, can look at the list of factors and count points that when they're counted together, depending on their age and several other factors, can tell him if he's in high risk or not high risk, regardless of his age. And so by identifying a subgroup of the non-elderly adults that are at higher risk and asking them for differential behavior and differential risk-taking, this allows you more confidence in your exit strategy in order to do some more massive openings, because you know that the patients that are most likely to end up in the ICU wards are more segregated than others. So this kind of a differential approach, I think, is very helpful. Another thing that we found helpful was, I would say, differential lockdowns. So you can have, we have a very wide net of testing being done continuously daily. Generally speaking, until about a week ago, over 10,000 such tests being done per day in a country of about 9 million people. And by doing that, we could identify new sources of locations, localities that have a problem that's only beginning. We call them the red locations. And by directing all the attention to those locations and making quick lockdowns, we can figure out the situation without going elsewhere. So I think that's a worthwhile something that can be done. And the last point that I will make is that an international consortium that we've started on what we call a symptom reporting mechanism, in which you collect voluntarily from people anonymous symptom reporting, and you aggregate it, and by those symptoms you can identify areas before the actual morbidity begins to ensue, and before you actually begin the testing and proving that there's a problem there, you can get signals. And we now use those signals to identify those locations and get there early. I think I'll stop there.
Thank you. Gary, I would like to discuss maybe more specifically Israel-Austria cooperation, because Chancellor Kurz publicly said that Prime Minister Netanyahu was actually the one who called his attention to the danger of the pandemic. So how has this bilateral cooperation developed since then?
To my knowledge, those politicians both are in direct personal contact for a longer period now. And yeah, that's true. Our Chancellor Kurz said that one meeting, I mean an online meeting with Prime Minister Netanyahu and others, I mean other countries or representatives from other countries, was like eye-opening for him. And to see the danger of the development. This was true for the politicians. For the experts, this was not true like this, because we always saw that the exponential growth of the curves, of the lines, of the numbers of infectious people. We always moved our structures, our government, to increase the testing capacities, to establish better plans, like more tier plans, multi-tier plans to react on the situation. because, I mean, this is obvious now, and we were discussing it before with these 2 weeks of delay between action and reaction. It is very hard to steer. If you're steering a car and the reaction of the car would be with a 5 seconds delay, you most probably will lose control about this car. And the situation is very similar. Was very hard to manage this situation. On the other hand, yes, it was very important to act quickly. More than this, I think it's important to act timely, because if you act too early, then you also lose the population, the compliance of the population, because they don't have the feeling already that there's danger approaching. So it's time-wise, it's a very difficult thing to do, to act precisely, and the same is true for location. So what we had, and most of the countries in Europe had, is a complete lockdown of the whole country, even when it was not necessary. Maybe it was would have been better to have a more precise but smaller in terms of region lockdown, and to mitigate all the economic impact or losses that are the follow-up of this, or the consequence of this. This, I'm sure we all will learn for more waves to come, and experts in Austria are quite sure that more waves of infection will come in autumn and winter, when there's a camouflage effect from the seasonal flu, and all these health problems, these respiratory problems, start covering COVID-19 cases. And for this, we need to have a very high sensitivity. So we cannot afford to oversee many cases, because they will start this exponential growth again. So we must accept many false positives, and we must urge the population, the people in our country, to accept this fact that maybe they will be isolated or in quarantine for, I don't know, 1 week, and it will prove false afterwards. But this has an effect. This is a matter of solidarity. It's a matter of caring for others, of caring for the society to do that, and to accept that. And so what we are right now talking is about hyperlocalization of measures, of lockdowns, of quarantines, of whatever, because this will be most probably the way to balance, the health aspects of a political action, and societal, economically, social, and psychosocial aspects of this. And this is not only a matter of time; it's also a matter of size of the region you are targeting.
Thank you. We only have very little time left before taking the questions from our audience. I would like to ask a last question. Maybe Ran, if you can answer very shortly. I would like to touch upon the opportunities of cooperation that coronavirus has created between Israel and the Palestinian territories. Nikolai Mladenov, the special coordinator for Middle East Peace Process, whom we had the privilege to host recently, told the UN Security Council last month that he witnessed inspiring examples of cooperation between Israelis and Palestinians in this common battle. Can you maybe share with us some of these examples? Do you have some of these examples in mind?
So I think that, yes, from the very beginning, we have, I think decision makers have seen the situation in both sides of the fence, for that matter, as a intermixed reality, and have appropriately addressed it as such, and have done everything possible in order to share know-how and as well as resources in order to ascertain the adequate maintenance of the disease on both sides. And we know, diseases know no borders. Infectious diseases do not recognize neither political nor physical borders. and our fates are mixed together in this event. And I do think that a lot of this collaboration, ongoing collaboration in education, in resources, and in others have helped maintain the security on both sides. And I think this is a good example of how such a collaboration can take place. We've seen it, by the way, in the past. We had an outbreak 10 years ago of avian flu. On both, again, in the some of the Palestinian territories as well as in Israel, and there was a very close collaboration. We even wrote medical articles in the main journals afterwards jointly. So we have, both sides, Jordanian, Palestinian, and Israeli authors on articles that explain why diseases have no borders and why we have to work together against this common threat for us all.
Thank you so much. Now it's time for questions from the audience. Here's to you, Barnabas.
Thank you, Julie. I'd like to remind our audience that questions can be sent via email at paris@ajc.org or by using the Q&A chat feature in Zoom or on Facebook. Now, the first question arrived from our friend Frank Rosenberg in New York City to Bo, and says, we heard a lot about crisis management on the lockdown and on opening up. Cooperation and best practices seem crucial so that some countries can learn from each other. What about the exchange and cooperation in terms of finding a treatment or vaccine? Is there enough cooperation, or is it all me first?
Well, as you rightly say, there's a lot we can learn, and I think we are learning, and I think also just the interventions at this seminar show to which extent we are all grappling with the same kind of problems and dilemmas, and those who have stepped in a little bit earlier than others provide very, very important experience for those coming a bit after. And there's a lot of work ongoing, drawing on the experiences, because none of us have tried this before. And there's a lot of also features of this particular disease that we find it hard to understand, that it's not doing or behaving exactly like other diseases that we know. And of course, we are constantly building on this collective corpus of knowledge and insights, while recognizing that none of us have any knowledge of the long-term effects of the disease, and a lot of other questions that we're all struggling with. On the question of treatment and vaccine, I think the sad answer is that you have, broadly speaking, globally, 3 separate tracks racing towards finding both treatment and the vaccine. You have, if I may start first, with a European-led WHO track with the participation of a number of non-EU countries, including Israel, but also a number of other countries, pooling resources, both in terms of finance and in terms of knowledge and research, in order to pursue various tracks and research avenues towards developing a vaccine. But also cognizant of the fact that it is not only a question of finding a viable vaccine, but also huge challenges in terms of ramping up production and dissemination of both treatments, potential treatments, medicines, and vaccines. I mean, even if we had the vaccine today, it would be months, if not years, before it is affordable and available to people around the globe at massive scale. So one track is driven by the WHO and the EU, and basically embracing countries from all over the world, but with 2 very important exceptions. The United States is pursuing its own research and its own track in some sort of competition with this broader initiative, but of course without a cooperation with WHO which I think is the first time we've had a global health crisis since World War II, without the US being part of and a major driver in a collective effort to have a breakthrough in research and indeed in financing. And you have China in a third track, partly associated with the EU global WHO track, but also very much pursuing its own line of both research for vaccine, research for medicine, and preparation for the production of both. So I cannot report that we have a unified effort in the world. And the fact that we don't, of course, does suggest, as you allude in your question, that we may end up in a situation where some parts of the world have access to vaccine or medicine and others do not. And we may even end up in a situation where it is not absolutely obvious that those who are first in developing the vaccine will also be willing to make it available as cheaply and as widely as possible. So there is a race ongoing, but those of us who are on this call today on the European side and from Israel, we are part of the same effort, an effort which the WHO and thus the UN system, of course, is also part of. And within that system, there is a degree of collectivity and common fate, because we all know that whereas there are a number of companies and laboratories and universities that are pursuing different avenues towards a possible breakthrough, only a massive collective effort has any chance of getting this to us earlier rather than later. I'll stop there.
Thank you, Bo. And we have the next question from Elik to Ron. If you could answer this. People believe the governments are employing herding immunization. What are your thoughts?
So the concept of herd immunity has been raised early on, and it is very enticing to think about that. As we know, every infectious diseases has a certain threshold where the relative immunity of the population actually makes it so that every single patient eventually infects one additional patient during the whole time of the disease. When you reach that point, for instance, if every patient should infect 2 people and 50% of the population is immune, then instead of infecting 2, they would infect 1. And that 1 would later on infect 1. And this is called herd immunity. But in order to reach that, according to the basic infectiousness of the disease, you have to have 50%, sometimes more than that, percent of the population that is immune. Reaching an immune state for 50%, even 40 or 30% of the population would have tremendous, horrible toll on society in the country that would make this attempt. Because in this process, many people would be hurt, even those in the low risk part of the society, especially in the high risk part of society. And so as a strategy, trying to build up illness in order to build herd immunity is probably not an advice I would give any country at this point or in any point at all. There's an additional lack of data about how long this immunity lasts. So people that have been infected, how long will they stay immune? What percent of them actually develop full immunity? And all of these question marks do not allow to take this kind of strategy as something responsible that you can take. So I would shy away from any concept of herd immunity now or in the future until we know some other data than we have right now.
Thank you, Ran. The next question, if we can turn back to Austria for Gary, maybe for a last question. Chancellor Kurz praised the discipline of his fellow citizens. We also hear a lot about the need for resilience. So do you think the discipline has been key?
First of all, the awareness was key. So people in Austria were very much aware at the beginning of March about the situation and the possible development of the situation, because media coverage was high, and all of us who could understand understood what is going to happen, and many measures of the government were already anticipated by the people. So the lockdown met a situation where people already chose to keep the spatial or physical distance from each other, where parents were starting not to send their kids to school. And all this happened because, first of all, there was a very high level of awareness and information. And second, we also started campaigning at this time, because you know that information is the one hand, but you know, to keep the repetition of the messages, you know, and we have like 4 hygiene messages right now. So keep this distance, wash your hands, wear your mask, and use your Stop Corona app. So, and this is, you know, if you're going to repeat this message often and often until you can't hear it yourself anymore, then it's the degree you need to campaign for the people. And of course, the discipline was high. There was just one day that was a little bit tricky in the Austrian population, because the lockdown was not communicated in a big bang, but in a 4-step process. And there was every day was another bad message for the people. And on day 2 or 3, there were rumors about locking down Vienna, the city, the capital city of Vienna. You know, there were scenes at the supermarkets you didn't expect to see. But on the other hand, the compliance, the awareness, and the reaction of the population was great, and it was quite easy for us to control the situation with this. On the other hand, what you see right now is that there is a big demand now for enjoying spring and summer, and to go out again and to ease all the message. Because what people see now, and this is a paradox zone, of course, a prevention paradox zone, that with all these measures we took, we kept the numbers low, and now people are, I mean, more or less populists are arguing that why do we need all this, or did we need all these measures, because, you know, numbers are so low, so they were for nothing. And, you know, they are mixing up cause and effect. And in this very difficult situation we are right now, and we need really to argue and to put all the arguments to the table that it might have been necessary what we did. We will know in history then, but we think it was necessary. We are already running for the compliance of the population, you know, to mitigate the effects of a second, third, or other waves are soon to become.
Thank you very much. This conversation has come to an end. It could have lasted, of course, longer. There are many things to say. I would like, on behalf of all AJC, to really thank our very distinguished panelists, also for the time you spent with us, given your respective very busy schedules.
Please stay tuned with AJC. Our next event will be tomorrow at 12 p.m. Eastern or 6 p.m. in Europe, a discussion with Einat Wilf on the prospects of an Israeli-Palestinian peace. For more information, please visit our social media or ajc.org. Please stay safe and healthy. We're looking forward to seeing you again soon on our programs.
Thank you. Goodbye.